Did you know that about 1 in 3 men experience premature ejaculation at some point in their lives? This common sexual health issue affects a significant portion of the male population, yet it often goes undiscussed. It's crucial to bring this topic into the open, not only because it's prevalent, but also because it can profoundly impact one's quality of life. Understanding and addressing this condition can lead to improved relationships and personal well-being. So, what exactly is premature ejaculation? Let's unpack this. Premature ejaculation is more than just a clock-watching issue. It's a common sexual concern, affecting a significant proportion of men at some point in their lives. But what exactly is premature ejaculation? Medically, it's defined as ejaculation that occurs sooner than desired, either before or shortly after sexual penetration, and happens with minimal sexual stimulation. This condition is not just about the timing. It also involves a lack of control over ejaculation that is frustrating and leads to distress for one or both partners. The medical community typically uses certain criteria to diagnose this condition. One key aspect is the persistent or recurrent nature of the episode, occurring within about 1 minute of penetration and before the individual wishes it. The roots of premature ejaculation can be both psychological and physiological. On the psychological front, factors like anxiety, relationship problems, or stress can play significant roles. Physiologically, it might be related to abnormal hormone levels, inflammation, or nervous system issues that affect ejaculatory control. Understanding this issue deeply shows that it's not a simple matter of self-control or stamina. It reflects a complex interplay of mental and physical elements that are unique to each individual. The distress it causes can be profound, making it crucial to approach this topic with sensitivity and an open mind. Now that we know what it is, you might wonder what triggers this condition. The causes of premature ejaculation can be as complex as the condition itself. To untangle this intricate web, let's delve into the psychological and physical factors that contribute to this sexual health challenge. Starting with the mind, psychological factors play a pivotal role. Anxiety, whether general or specific to sexual performance, can create a high level of stress that disrupts the natural rhythm of sexual response. It's like setting off a sprint in what should ideally be a balanced marathon. Relationship issues also weave into this narrative, where emotional disconnect or unresolved conflicts can manifest physically, speeding up ejaculation. Stress, an unwelcome guest in any scenario, compounds these issues. It acts almost like a catalyst, hastening the ejaculation process when the body and mind are supposed to be in harmony. This psychological trio, anxiety, relationship problems, and stress, creates a stormy climate, making it challenging to maintain sexual control. Switching gears to the biological spectrum, several physical causes also lay the groundwork for premature ejaculation. Abnormal levels of hormones, which govern the body's sexual functions and responses, can disrupt normal operations. Inflammatory conditions and infections can cause discomfort or heightened sensitivity that leads to faster climaxes. Moreover, erectile dysfunction, a condition often kept in the shadows, closely ties with premature ejaculation. The pressure to maintain an erection can lead to a rush during sexual encounters, which paradoxically can end them sooner. Understanding these causes helps demystify the condition, but beware of common myths that cloud the truth. Let's clear the air on some widespread misconceptions. One of the most common myths about premature ejaculation is that it's purely a result of anxiety. While stress and anxiety can indeed play a role, they are not the sole culprits. Biological factors, hormonal imbalances, and even genetic predispositions can also contribute. It's essential to understand the array of potential causes to effectively address the issue. Another pervasive myth is that premature ejaculation is strictly a young man's problem. This couldn't be further from the truth. Men of all ages can experience this condition, and its prevalence does not sharply decline with age. Acknowledging this can help reduce the stigma and encourage men at any stage of life to seek the help they need. Lastly, let's tackle the misconception that personal habits like smoking or drinking have a direct impact on this condition. While lifestyle choices can influence overall health, premature ejaculation has more complex roots and often requires a broader approach for management. Armed with facts, those affected can more effectively approach solutions. Now, how can one manage or potentially stop premature ejaculation? Let's explore some practical tips and effective solutions that can make a significant difference. Firstly, behavioral techniques are a cornerstone of managing premature ejaculation. One popular method is the stop-start technique. This involves stimulating the penis until the feeling of ejaculation nears, then stopping and allowing the arousal to decrease before starting again. This helps in gaining better control over the timing of ejaculation. Another technique is the squeeze method. This involves squeezing the penis in the area between the shaft and the glans for about 30 seconds when ejaculation feels imminent. This can interrupt the ejaculation process and lessen the urge, thereby helping to extend the time until ejaculation. In addition to behavioral techniques, pelvic floor exercises, commonly known as Kegels, strengthen the pelvic muscles and can improve ejaculatory control. To perform a Kegel exercise, one needs to contract the muscles used to stop the flow of urine, hold for 3 seconds, and then relax for 3 seconds. Doing this several times a day can significantly improve control. On the medical front, topical anesthetics like lidocaine or prelocaine creams can be applied to the penis to reduce sensitivity. This often helps delay ejaculation. Selective serotonin reuptake inhibitors or SSRIs are another option. These medications can increase the time it takes to ejaculate and are often prescribed for long-term results. Communication with your partner is also vital. It helps in managing expectations and enhancing mutual understanding and support. For some, professional help from a therapist or a healthcare provider who specializes in sexual health might be beneficial. Remember, finding the right solution can be a process of trial and error. To wrap up our discussion on premature ejaculation, let's revisit the essential insights we've explored today. Understanding what premature ejaculation truly is marks the first step toward effective management. It's not just a fleeting issue, but a common sexual health condition affecting many individuals across the globe. We've delved into the various causes that can contribute to this condition, from psychological factors like anxiety and stress, to biological influences such as hormonal imbalances and neurological problems. It's clear that the roots of premature ejaculation are diverse and complex. Moreover, we tackled some prevalent myths that often cloud the topic, shedding light on the facts and dismissing common misconceptions. This clears the path for a more informed approach to dealing with the condition. Most importantly, we've outlined practical solutions and strategies that can significantly aid in managing premature ejaculation. These include behavioral techniques, lifestyle adjustments, and when necessary, medical interventions. With the right information and support, managing premature ejaculation is entirely possible. Never hesitate to seek help and discuss this openly with healthcare providers.